Good morning, everybody. This morning we're going to start with a presentation of a B2 student. She's just finalized her level. Please introduce herself and tell everybody what you're talking about today.
Good morning, everybody. I am Claudia Guayasamin. I am a doctor, and now I am going to talk about obesity. To get started, what does it mean to have obesity? Obesity refers at an excess of fat. It is a problem because it increases the risk of many health problems. It can also make it hard for you to move, breathe, and do other things that the people who have a healthy weight can do easily. Doctors use a calculation called body mass index or BMI to decide which a person is underweight, at a healthy weight, overweight, or has obesity. Your BMI will tell you in which category you are based on your height and weight. If your BMI is between 25 and 29.9, you are overweight, and if your BMI is 30 or greater, you have obesity. What are the health risks of obesity? Having obesity increases the person's risk of developing many health problems. Here are just few examples. The number one is diabetes. Having obesity increases the person's risk of developing type 2 diabetes. All the cells in the body need the sugar to work normally. The sugar gets into the cells with the help of an hormone called insulin. Insulin is made by pancreas, an organ in the belly. If the body stops responding to insulin, the sugar builds up in the blood. There is what happens in person with diabetes. Diabetes is where the body stops responding to insulin normally, and then over time the pancreas stops making enough insulin. The second risk is high blood pressure. Excess weight typically raises blood pressure. Numerous mechanisms by which the obesity rise blood pressure have been proposed. For example, the fat around the kidneys increases the renal injury, and the obesity causes hyperinsulinemia and blood vessels dysfunction. An individual blood pressure is defined by two measurements. The first is the systolic pressure, which is the pressure in the arteries when the hair contracts at the time of the beat. And the diastolic pressure, it refers to the pressure during the relaxation of the heart between the heartbeats. The blood pressure is reported as systolic pressure over diastolic pressure, for example, 120/70. The third risk is high cholesterol. The accumulation of cholesterol in the arteries, secondary of obesity, makes the arteries narrowed and trigger many health problems. The fourth is heart disease. The secondary of diabetes, high blood pressure, and high cholesterol, this cause the coronary artery dysfunction, and finally the heart disease. The stroke is secondary of brain arteries injuries. And the obesity gets worse the other health conditions, for example, asthma, sleep apnea, and cancer. Does having obesity shorten a person's life? Yes, studies show the people with obesity die younger than people who are a healthy weight. The degree the risk increases depends at how how long the person has had obesity and what medical problems they are. The people with central obesity might be at um, risk of dying younger. The central obesity refers to carrying excess fat in the belly area, even if the BMI is normal. Should I see an expert? If you have obesity, you can talk to your doctor. He might have suggestions of healthy ways and different ways to healthy lifestyle. It also can help to work with a dietitian. A dietitian can help to choose healthy foods and plan meals. Are there medical treatments that can help me lose weight? There are many medicines and surgery to help us lose weight, but those treatments are only to people who draw lifestyle change as a diet and exercises. Those treatments don't take the place of diet and exercises, and the people who have those treatments must be at must change the how they eat and how active they are. What can I do to prevent the problems caused by obesity? The best thing you can do is lose weight, but if it is not possible, you can improve your health and lower risk with become more active. Many types of physical activity can help, including walking. You can start a few minutes a day and add more a day as you get stronger. Anything if you get moving body is good for you. And improve your diet. It is good for you have regular planned meals and limit the sweets and avoid processed food, and try to eat more vegetables and fruits. And the other things that you can is quit smoking and limit alcohol. What causes obesity? The thing that increases the person's risk the most is having an unhealthy lifestyle. But there are more things that the people don't know. For example, the moms having during and after pregnancy. People who eat a lot and have diabetes and smoking during pregnancy, they have more likely to having babies as obesity in adults, and babies who drink formula might be are more likely to develop obesity later in life. The other things is habits and weight gain during childhood. Children and teens with obesity are more likely to develop to become obesity in adults. The other things is sleep a little, take certain medicines. For example, some medicines we treat depression, and certain or more conditions, for example, the polycystic ovary syndrome, where the weight gain and exists other symptoms, for example, irregular periods. What if I want to get pregnant? If you have obesity, it might be harder to get pregnant, and in males, it causes sex problems. And what if my child has obesity? The children have the same risk as adults to develop diabetes, high blood pressure, sleep apnea, or asthma. And at the children grow faster than normally, and the girls start the poverty than normally. It is my presentation. I hope you like it. Thank you.